So I have many thoughts about those studies, but I guess I could sum them up with 4 words. Show me the outcomes. Clinical outcomes are the standard, particularly for ambiguous cases. So several studies have now claimed that the myPath test misses almost half of ambiguous or challenging to diagnose melanomas. Yet there were few, if any, clinical outcomes in those ambiguous melanomas. Now, to be fair, we expect some false negative results. We know the test isn't perfect, but 50%? The myPath test has now been compared to clinical outcomes in more than 300 patients. And false negative results occurred in less than 5 to 10% of all melanomas. So claims of a false negative rate that is 5 to 10 times higher than that requires some proof in the form of clinical outcomes, particularly when those cases were considered diagnostically challenging in the first place. Without proof in the form of clinical outcomes, I'm comfortable speculating that the reason that many of those cases were considered challenging to diagnose as melanomas is because they weren't melanomas. They were nevi with unusual morphologic features. There are now more than 4 to 5 decades of epidemiologic evidence that strongly suggests that many melanocytic neoplasms that are histopathologically ambiguous are biologically benign. And so the results of these studies would actually corroborate that epidemiologic evidence.